Dr. Dawn Lim's job is emergency medicine. She's on the front line treating patients with COVID-19, but there's another layer to what she does. After a shift or on her days off, she picks up her camera and turns it on her colleagues, capturing what few of us see: the care, the precision, and the unpredictability of what it takes to save lives. Dr. Lim wants to create a permanent record of how this pandemic plays out. She's shared her photographs with us.
My name is Dr. Dawn Lim. I'm an emergency physician at the University Health Network, which is Toronto General Hospital and Toronto Western Hospital. My son is 4.5, almost 5, and my daughter is 16 months now. So every time I say goodbye, I close the door and my son's always waiting for me with my daughter and my husband. He bangs on the window and he says goodbye. He makes a little heart with his index finger and his thumb. And he tries to shout, "I love you, Mom," and goodbye, but that's what he means when he says that, to make sure that I'm brave. And as soon as I get back, everything comes off and goes straight into the wash. And I don't hug my kids. I don't say even hello to them until I've had a really long shower. When the fear of the pandemic and the unknown started, that's when we started actually talking to our colleagues who had gone through SARS and what was that like. And one of them told me that it was very hard for her team because afterwards, when the last patient was cured and they lifted the restrictions, it wasn't something that they talked about. And so I felt like this story couldn't be forgotten the same way that SARS was forgotten. Because we wanted to make sure that each person with COVID or suspected COVID had the minimal exposure to team members, the hospital actually created a team called the Code Delta team, which is an intubation team staffed by an anesthesia assistant, a nurse, and a staff anesthetist. They're checking their equipment, they're making sure they have all their medications, and they're making sure that they're completely covered and safe for the intubation. I felt at the very beginning, I thought maybe it was a crazy idea to try to document the pandemic because I thought maybe people wouldn't be receptive. When I brought up this idea, that people were very supportive of it, and they knew that if we didn't talk about it, then the story would be forgotten, just like SARS. The patient is about to be intubated. It's very challenging, so they decompensate very quickly, so you pretty much have one shot to get the intubation before they get into trouble. And the person who's doing the intubation really wants to minimize any type of procedure that will increase aerosolization, so it's first shot, one shot, do it right. Usually we are used to dealing with patients who are very sick. That's not new, but patients with COVID, they look well until they don't look well, and that's been very scary. Visitors aren't allowed, and so when we do have patients who die, not being able to close that circle and have the family nearby has been really tough for the team. So she's got the baby monitor in her hand, and she's looking very carefully to see what the team needs. So if you imagine the face shields and the face mask, it's very hard to hear people. And then you've also got the wall of glass. Only a few can stay inside, and everyone's on the outside, and everyone's waiting to see what's going to happen and waiting to make sure that the team inside has everything that they need. He and his team are responsible for making sure that the room is meticulously cleaned after each patient. And you see that he's doing a lot of work to keep the whole team safe. We really appreciate them. A lot of the pictures, people's eyes are so focused and you see such a concentration. But I do see a strain on people's faces, and I do see the uncertainty in their eyes because we're there to help them, and at the same time we feel very vulnerable ourselves, and that's very hard to talk about. I think it's very common for healthcare providers to not feel that they necessarily can ask for help, or if they do need help, there's a stigma associated with that sometimes. And this is the pause that our teams do at the time of death to pay respect to the patient. That pre-COVID, it was quite common to have the family members nearby, but this patient had only the medical team to say goodbye. So, looking at this, I think this was a very special moment for this team as well, because they knew that they tried to do everything that they could, and still they lost the patient. So yeah, it's the time of death. So a very moving photo for the team as well. Storytelling for me is the most powerful tool that we have for connection and healing. But I hope that by doing this photo essay, people remember that feeling that they had when we came together as a team. That's what I hope that they take away from it, because I think that's the power of art. It gives us permission to pause and reflect.